Good evening and thanks for joining us. We begin with fast-moving developments in the coronavirus. There are now more than 97,000 cases of COVID-19 worldwide. And the Canadian doctor who is the assistant director of the World Health Organization says now is the time for countries to pull out all the stops.
We're seeing evidence that this can actually be contained and controlled, but we're not seeing that effort to contain and control it keep pace with the spread. So we're right at a tipping point where the commitment of governments and countries to really get on top of this is going to be crucial in the coming few days and weeks.
That's Dr. Bruce Aylward. He's just returned from studying the outbreak in China. I spoke with him today about what he learned there about the virus, how it spreads, and who it kills. That's coming up. First, though, the numbers. Canada now has 12 new cases. That includes the first presumptive case just announced in Alberta, a Calgary woman in her 50s who was on the Grand Princess cruise ship. We'll tell you more about that in a moment, too. If her test is confirmed, it means a total of 46 in Canada. BC has 8 new cases. Half are connected to previously identified cases and linked to travel to Iran. One, though, is a woman who hasn't traveled and had no known contact with anyone who did. It appears to be the first case of community transmission in Canada. The other cases are in Ontario, and 2 others are in Quebec. In the U.S., 18 states have now detected the virus. Most have just 1 or 2 cases, but in California and Washington state, there are clusters of illness. South Korea, Italy, and Iran are still the hardest hit. In China, where this outbreak began, new infections have slowed dramatically in the past 2 weeks. Around the world, there are nearly 98,000 confirmed cases and more than 3,300 deaths. The WHO says China appears to have suppressed the outbreak in Wuhan because it acted fast, and that can be replicated, it says, in other countries, including Canada. But worst-case scenario planning should be well underway. In tonight's top story, David Akin looks at whether Canada is heeding that advice.
Among the latest COVID-19 cases in Ontario, a man in Toronto just back from Iran, and a woman in Kitchener just back from Italy.
That's a new one for us. First from Italy. With what's going on in Italy, I would be expecting some more.
Some regions of Italy, along with China, Iran, and South Korea, are the world's COVID-19 hotspots. Canada is screening travelers arriving from those regions and taking action on a case-by-case basis. But other countries, the United States, Indonesia, and most notably Australia, have taken a much more restrictive approach. Australia now bans all foreign nationals arriving from South Korea, China, and Iran. And Australian citizens arriving from those countries face a mandatory 14-day quarantine, no matter their health condition. But Prime Minister Justin Trudeau said Canada would stick with its case-by-case approach.
There is a lot of misinformation out there. There is a lot of knee-jerk reaction that isn't keeping people safe. The decisions we make are based on the best recommendations of the WHO and the tremendous health experts who work both in Canada and around the world.
Ontario's top public health official said Australia-style travel bans may not work for Canada.
Our experience is that they only work to a limited extent. As you can see, some countries had quite strong travel bans, like the U.S., like Italy, and it didn't prove to be successful at this time.
Travel bans can also increase the damage to the economy, and the day after the Bank of Canada slashed its key interest rate because of the economic impact of COVID-19, Bank Governor Stephen Poloz cautioned about the uncertainty ahead.
We believe we've done a lot there to cushion a blow. We don't know how big the blow might be, so we'll be looking at ways to figure out how big that blow might be and how long it might last.
That uncertainty weighed on investors. The Dow Jones Industrial Average fell by more than 3.5% Thursday, while Canada's benchmark S&P TSX Composite was down by more than 1.3%. Finally, Donna, it's important to mention that Canada's public health officials, like Dr. Williams, continue to say that Canada's containment system is working and the risk to public health remains low.
That is important. David Akin in Ottawa, thanks. More new cases have emerged in Europe, and in the UK, the first person has died. Authorities say an elderly person with underlying health conditions is the UK's first COVID-19 victim. 25 more people tested positive there, bringing the total in the UK to 115. The Prime Minister's official spokesperson warned today that it's highly likely the virus is going to spread in a significant way. In Greece, the number of cases jumped from 10 to 31. Authorities have shut down schools and universities and banned major public gatherings in parts of Greece for at least several days. Similar bans are already in place in Italy and Iran, where the healthcare systems are struggling to cope with thousands of infections. And passengers on board the Grand Princess cruise ship, owned by the same company as the Diamond Princess, are in limbo tonight. It's being held off the coast of San Francisco because a man who had been a passenger has since died of the virus. It's the same ship a Calgary woman was on. She's Alberta's first presumptive case. More than 20 people who are still on board are showing symptoms. As Abigail Bimman reports, among the thousands of passengers are 235 Canadians.
They are bleaching and wiping and going on and on and on.
A live stream from two sisters stuck on a cruise off the coast of San Francisco.
My heart rate was like, whoa, whoa, whoa. I was like, everything was running through my head, and I didn't want to go home. I don't want to go home to my family because I don't want to take anything to them. Right. I don't want to take it to my city if I happen to have it on my clothes or whatever.
Half the passengers are from California. 235 Canadians are aboard too.
We are going to be flying testing kits to the cruise ship, and we are going to be sending those quickly back.
The first COVID-19 death in the state of California was traced back to a passenger who was aboard the same ship last month. The governor has issued a state of emergency joining Florida and Washington state. There, an old motel will be turned into a quarantine facility with at least 10 deaths and a new spike in the number of cases. And New York saw its number of cases double Thursday.
What ends up happening is that there's a friend of the person who is in the hospital, and then that person has a friend, and then they have family and relatives.
But in a Fox News interview Wednesday, the American president questioned the World Health Organization's official death rate.
I think the 3.4% is really a false number. Now, this is just my hunch, because a lot of people will have this, and it's very mild. Personally, I would say the number is way under 1%.
Medical experts expect the number of U.S. cases to climb further once more tests are done.
We don't have enough tests today to meet what we anticipate will be the demand going forward.
American officials previously promised 1 million tests would be available by the end of next week. Meanwhile, lawmakers here approved $8.3 billion in emergency spending to combat the outbreak. Abigail Bimman, Global News, Washington.
There's an upgraded travel warning from the Canadian government tonight. Canadians are now being told to avoid all travel to Iran. That country is dealing with one of the worst COVID-19 outbreaks outside China. People coming to Canada from Iran and from Hubei province in China are being asked to voluntarily self-isolate for 2 weeks when they get here. Mike Drolet explains how self-isolation and social distancing can help limit the spread.
It was jarring to see Canadians returning from Wuhan, China, quarantined at CFB Trenton. But while it may have stoked fears of an outbreak of COVID-19, none of those who lived in isolation for 14 days were infected by the virus. It was a precaution, similar to when Marilyn and Tom Shook returned to Saskatchewan from a February cruise in the East China Sea and were told they needed to self-isolate. So they did, voluntarily.
We weren't quarantined. It would be different if we had the disease. I don't know what they would have done if we would have told them, no, we're going to just go around waiver.
Health officials have 3 options here in Canada. Isolation for patients who are infected, but they can also ask people like the Shooks to self-isolate as a precaution. So it's a broad term. Quarantine, which restricts the movement of people who may have been exposed but are not yet sick, and social distancing, which prevents people from congregating in large crowds.
The public health infrastructure does have the power to do all sorts of things that normally you would not do to people.
We've seen social distancing in other countries. The Japanese Baseball League is playing its preseason games in empty stadiums, and there are discussions to postpone the season outright. And in the NBA, players have been told to refrain from high-fiving fans and no more autographs. But most pressing for Canadians right now is what happens if you need to stay home. Politicians in Ontario and Nova Scotia are pushing for temporary measures whereby employees would not have to get a doctor's note, as well as ways to offset the potential for lost income.
They've warned the current provincial labour laws are, quote, a serious threat to the health and safety of Ontarians.
The idea is to make self-isolation less burdensome. because nobody should have to feel like they're fighting this alone. Mike Drolet, Global News, Toronto.